It all began with a sudden accident. A man fell, clutching his leg in pain. He couldn't move. Thankfully, someone nearby quickly contacted his family and the emergency services. Soon, he was rushed to the hospital. After a series of examinations, the doctors discovered that he had a femoral neck fracture. Surgery would be necessary. The anesthesiologist came to his side and gently asked how he was feeling. The patient was in agony. Despite using many painkillers, nothing seemed to help. He begged for relief. The anesthesiologist reassured him and explained that they would give him a special pain-relieving injection guided by ultrasound. This wasn't just a simple needle prick. It was carefully done to bring real relief. Moments later, the patient's pain eased, and he could breathe more comfortably. He mentioned he had high blood pressure, diabetes, and coronary artery disease, but with the pain under control, even his heart felt better. The anesthesiologist carefully carried out the preoperative checks, monitoring blood pressure, blood sugar, and heart condition. He reminded the patient to continue following the doctor's instructions for his medications. When asked if he had any recent fevers, colds, coughs, or phlegm, the patient replied no. Before surgery, the anesthesiologist explained the next step: spinal anesthesia, often known as partial anesthesia. The patient asked nervously if it would hurt. With a gentle smile, the anesthesiologist reassured him. First, a local anesthetic would numb the spot, then the spinal injection would be performed. The patient cooperated, and before he realized it, the procedure was over. Surprised, he said it only felt like a mosquito bite, then no pain at all. As the operation began, the unexpected happened. Alarms sounded. There was sudden bleeding at the surgical site. The patient's blood pressure dropped and his heart rate spiked. The anesthesiologist immediately gave urgent instructions to the nurse and ordered blood tests. Tension filled the room, but after swift action, the patient's vital signs stabilized. The anesthesiologist finally exhaled in relief. In the operating room, a busy anesthesiologist is never a good sign. Their job is to maintain calm and stability at all times, standing by the patient's side every second. The patient, filled with gratitude, thanked the anesthesiologist, admitting he never realized how challenging their work truly was. The anesthesiologist smiled and replied with a gentle reminder. Next time you catch the bus, please be more careful. But he also explained something more important. Anesthesiology has entered a new era. It now plays a vital role in speeding up recovery after surgery and improving outcomes. Anesthesiologists are not just experts in medication, but also in ultrasound, arteriovenous puncture, endotracheal intubation, and nerve blocks. Beyond the operating room, they help patients undergo painless procedures such as gastroenteroscopy, bronchoscopy, and even painless childbirth. They also support therapies for stubborn sleep disorders in specialized clinics. So now, it's clear. Anesthesiologists are more than the doctors who put patients to sleep. They are guardians of life, recovery, and comfort, dedicated to making every procedure as safe and pain-free